mental health clinicians. They go to this work because it's a calling, because they recognize something in themselves or something in others that gives them the passion and the wherewithal to pursue it. I'm a psychiatric social worker. I have 30 years with Kaiser Permanente. I started in 1988. My primary specialty is psychiatric emergencies. I've done that pretty much my whole career. And I became involved with union work. The mild-mannered mental health professional became an activist.
As an elected representative of the National Union of Healthcare Workers.
What being a part of NUHW means to me as a clinician, I'm on the executive board, and I have an opportunity to serve patients and to be member-driven, bottom-up, and listen to the clinicians who do this work every day and understand the nature of our long-standing fight.
The issues of patient care and deep cuts that Kaiser is wanting to deliver to all the union employees really punctuated the need for this event statewide. I don't think you'd see this many workers come out unless it was really important.
NUHW really does represent the only game in town who was willing to take on a behemoth like Kaiser. Not an easy endeavor, and really required that mental health professionals who, for the most part, are hardworking, conscientious, ethical people who just want to do a good job and not have any problems, to take those people and turn them into activists enough to really demonstrate the gravity of the problems. That's what we were up against.
What do we want?
Hundreds of mental health workers have launched a week-long strike at Kaiser Permanente hospitals across California.
Kaiser's policy seems to be to save on these labor costs year after year. It's gotten to the point where it's just immoral.
And Kaiser, being as big as it is, I don't think it's hyperbole to really say that they're such a big player that they have the potential for shaping the industry. And that was very attractive to our members. And it was attractive to me personally. It was a strategic and multifaceted campaign on many levels, encompassing media, social media, strikes. The Courage campaign got involved, political figures became involved. It was really quite an amazing arc of activism.
Some people thought we could never sort through the complexity of the mental health service model in order to mount a convincing argument to the state about the seriousness of the problems in mental health service delivery at Kaiser, and we did that. Some people thought that nobody would pay attention to a small unit of mental health workers at Kaiser, but the result of your action this week was 800 media outlets throughout the country that have covered this strike. Kaiser, the whole world is watching. Folks, you have done all that.
The victory with Kaiser Permanente meant that we actually had a voice at the table, a meaningful voice in terms of how decisions would be made in Kaiser Permanente when it comes to mental health services. We won a voice. Our advocacy allowed us to be taken seriously in a way that we hadn't been before. And of course, the improvements to patient care. Patients get a much enhanced capacity to be seen and to have their issues addressed. And if that goes afield, we have a mechanism now for bringing it back online.
What suicide is?
The gains that we made were very meaningful, but there is still work to be done. The struggle continues. The evolution of timely, quality mental health services at Kaiser will continue to improve. That, by definition, is a process that's characterized by a certain amount of conflict. And how we mediate that conflict will shape what's going to come next. But I'm optimistic We've never found ourselves in a position quite like this before. I like to say that we're, young adults, late adolescents in our trade union development. Here's how it lives on in the moment with our new, eager mental health clinicians. You are part of something that's not only delivering care to your individual patients, but part of a movement to make manifest the values that you trained to work with. This could represent the inception of a new generation of trade unionism, one that is really front and center because of their skill set in organizing. And I think that's really groundbreaking. NUHW's values, being patient-centered, being member-driven, it just doesn't get any better than that for me personally. And I believe in the mission to elevate quality mental health care and access to that care, because I feel like my contribution, my career contribution, is not only to the individuals that I have the privilege of working with, but also to the industry and to mental health services in this country. If you'd have said to me, Papazian, you're going to school, what are you going to be? If I told you I was going to be a mental health professional that was also a labor leader and helping move the industry, I would have laughed at you. So it's kind of a testament to the evolution of a person who kind of steps into something and then grows as the whole process kind of unfolds before him. So it's been a privilege.
What's this about?
Patient care!
What's this about?
Patient care!
Some people thought that we would never be organized enough to unionize, and we did that. Some people thought that nobody would pay attention to a small unit of mental health workers at Kaiser, and we did that. Kaiser, the whole world is watching. Folks, you have done all that. I remain absolutely impressed with your courage, conviction, and strength to improve mental health services and not accept anything short of a fair deal for mental health service providers at Kaiser. I remain absolutely convinced of your capacity and resolve to stand up and keep standing up until Kaiser listens to you. Folks, we can do this together. Thank you for the privilege of working side by side with you. It's a true honor.